Have you ever felt perfectly fine, only to discover later that something serious had been quietly developing inside your body? It happens more often than most people realize. Some of the most dangerous health conditions don't begin with intense pain or dramatic symptoms. Instead, they start with subtle warning signs that are easy to dismiss as just getting older. A little more fatigue, a few pounds lost without trying, occasional shortness of breath, or a change in memory may not seem alarming at first. But, according to doctors, these seemingly minor changes can sometimes be your body's earliest cry for help. If you're over 60, recognizing these silent warning signs could make a life-changing difference because many serious conditions are far more treatable when detected early. Stay with us until the end, because the final warning sign is one that many people ignore until it becomes a medical emergency. Getting older brings many normal changes. Your muscles naturally lose strength, your metabolism slows down, your skin becomes thinner, and your energy levels may not be quite what they were 20 years ago. But healthy aging should not mean accepting every new symptom as a normal part of growing older. One of the biggest mistakes people make is assuming that unusual changes are simply because of age. Doctors encourage older adults to pay attention when something feels different, especially if it lasts for weeks, becomes worse over time, or interferes with everyday life. The first silent warning sign is unexplained weight loss. Many people are happy to see the number on the scale go down, especially if they have struggled with their weight in the past. But losing weight without changing your diet or increasing your physical activity deserves attention. An unexplained loss of 10 pounds or more, or around 5% of your body weight over 6 to 12 months, can sometimes signal an underlying medical problem. There are many possible causes, including thyroid disorders, digestive diseases, diabetes, depression, medication side effects, or certain types of cancer. It doesn't automatically mean something life-threatening is happening, but it should never be ignored. Weight loss can occur because the body isn't absorbing nutrients properly, because an illness is increasing the body's energy needs, or because appetite has changed due to an underlying condition. Some people simply notice that their clothes fit differently, or their belt suddenly feels looser. Others realize they haven't been eating as much because food no longer tastes the same, or they feel full much sooner than before. Doctors often ask questions such as when the weight loss began, whether appetite has changed, whether there are digestive symptoms, and whether other changes have appeared at the same time. A simple medical evaluation, blood tests, or imaging studies may identify a treatable cause before it becomes more serious. Early evaluation is especially important because many conditions respond much better when detected early. The second silent warning sign is persistent fatigue that doesn't improve with rest. Everyone feels tired occasionally after a busy day or a poor night's sleep, but persistent fatigue is different. It can feel like your energy has completely disappeared, making everyday tasks such as walking to the mailbox, climbing stairs, preparing meals, or even getting dressed seem unusually difficult. Many people assume fatigue is simply another part of getting older. While energy levels do change with age, severe or persistent exhaustion is not considered a normal part of healthy aging. Fatigue may result from anemia, thyroid disease, heart disease, sleep apnea, diabetes, chronic kidney disease, depression, medication side effects, infections, or many other medical conditions. Some people notice they no longer enjoy activities they once loved because they simply don't have the energy. Others begin taking frequent naps during the day, but still wake up feeling exhausted. Family members are often the first to recognize the change, noticing that someone who was once active now prefers sitting most of the day. Persistent fatigue may also appear alongside other symptoms, including shortness of breath, dizziness, swelling of the legs, loss of appetite, or difficulty concentrating. These combinations of symptoms provide important clues that help healthcare professionals determine the underlying cause. Sleep quality is another important consideration. Many adults spend 8 hours in bed yet still wake up feeling exhausted because conditions such as sleep apnea repeatedly interrupt breathing throughout the night. Treating the underlying sleep disorder often improves both energy and overall health. Doctors also evaluate nutrition because deficiencies in nutrients, such as iron or vitamin B12, may contribute to fatigue. Staying physically active, eating balanced meals, and maintaining regular sleep schedules support healthy energy levels, but ongoing fatigue that lasts for weeks deserves medical attention rather than being dismissed. The third warning sign is blood where it shouldn't be. This includes blood in the stool, blood in the urine, coughing up blood, or unexplained vaginal bleeding after menopause. Although there are many non-cancerous explanations, including hemorrhoids, urinary tract infections, kidney stones, or certain medications, any unexplained bleeding should be evaluated by a healthcare professional. Blood in the stool may appear bright red or cause stools to look black and tarry. Blood in the urine may appear pink, red, or brown, although sometimes it is only detected during laboratory testing. Postmenopausal bleeding should always be assessed because it may indicate conditions affecting the uterus or cervix that require prompt evaluation. Ignoring unexplained bleeding delays diagnosis of both common and uncommon conditions. Even if the cause turns out to be something minor, having it checked provides reassurance and ensures that more serious illnesses are not overlooked. Another important point is that many serious illnesses develop gradually. They don't usually announce themselves with dramatic symptoms overnight. Instead, the body often sends subtle messages for weeks or even months before the condition becomes severe. Recognizing these signals and seeking timely medical care gives doctors the best opportunity to diagnose problems early, when treatments are often most effective. Many older adults hesitate to contact their healthcare provider because they don't want to bother anyone, or they assume the symptom will disappear on its own. While it's true that many symptoms have harmless explanations, doctors consistently encourage patients not to ignore persistent or unexplained changes. A simple office visit today may prevent a much more serious problem tomorrow. In the next part of this video, we'll cover 4 more silent warning signs that are commonly overlooked after the age of 60, including one symptom that could signal problems involving the heart or lungs, another that may indicate a neurological emergency, and a final warning sign that families often mistake for normal aging when it actually deserves immediate medical attention. The 4th silent warning sign is chest pain or shortness of breath. Many people immediately think of a heart attack when they hear the words chest pain. But the reality is that heart disease can develop gradually, especially after the age of 60. Sometimes the warning signs are subtle. Instead of severe pain, a person may feel pressure, tightness, heaviness, burning, or discomfort that comes and goes. Others notice they become unusually short of breath while climbing stairs, walking short distances, or doing household chores that were once easy. Shortness of breath should never be dismissed simply as a normal part of aging. It may be related to heart disease, lung disease, asthma, anemia, or other medical conditions that require evaluation. Some people experience breathlessness only during activity, while others begin waking up at night feeling like they can't catch their breath. Swelling in the ankles or feet, unusual fatigue, or dizziness occurring alongside shortness of breath can provide additional clues that the heart may not be functioning as efficiently as it should. Heart disease remains one of the leading causes of death worldwide, yet many of its early warning signs are treatable when recognized promptly. If chest discomfort or shortness of breath appears suddenly, becomes severe, or is accompanied by sweating, nausea, fainting, or pain spreading into the arm, neck, jaw, or back, it requires immediate emergency medical attention. Acting quickly can save heart muscle and, in some cases, save a life. The 5th silent warning sign is sudden weakness, numbness, or difficulty speaking. These symptoms may appear without pain, causing some people to ignore them or wait for them to pass. However, they can be signs of a stroke or a transient ischemic attack, often called a mini-stroke. A stroke occurs when blood flow to part of the brain is interrupted, depriving brain cells of oxygen. Every minute matters because brain tissue can be permanently damaged if treatment is delayed. Sometimes the warning signs last only a few minutes before disappearing. A person may suddenly have trouble lifting one arm, notice one side of the face drooping, struggle to pronounce simple words, or feel numbness on one side of the body. Vision may suddenly become blurred, or balance may disappear without warning. Even if these symptoms improve quickly, they should never be ignored because a transient ischemic attack can be an early warning that a more serious stroke may follow. Doctors often encourage people to remember the word fast. The letter F reminds us to look for facial drooping. A stands for arm weakness. S represents speech difficulty. T means it is time to call emergency services immediately. Rapid treatment dramatically improves the chances of recovery and reduces the risk of long-term disability. The 6th silent warning sign is a persistent cough or difficulty swallowing. A cough caused by a cold or seasonal allergies usually improves within a few weeks. However, a cough that lasts longer than expected, especially if it is accompanied by coughing up blood, unexplained weight loss, chest pain, or increasing shortness of breath, deserves medical evaluation. Chronic cough may be caused by asthma, acid reflux, certain medications, lung infections, chronic lung disease, or other conditions that require treatment. Difficulty swallowing is another symptom that many people mistakenly accept as a normal part of getting older. Some notice that food seems to stick in the throat or chest, while others begin avoiding certain foods because they are harder to swallow. Persistent swallowing problems may result from acid reflux, narrowing of the esophagus, neurological disorders, or other medical conditions. Left untreated, swallowing difficulties can increase the risk of choking, poor nutrition, dehydration, and lung infections caused by food entering the airway. Doctors often ask whether swallowing problems occur with solid foods, liquids, or both. They may also ask if there has been unintentional weight loss, frequent heartburn, or repeated episodes of coughing while eating. These details help determine the underlying cause and guide appropriate testing. The seventh and final silent warning sign is new confusion or significant memory changes. Forgetting where you left your keys from time to time is common. Occasionally struggling to remember a name is also something many people experience. But becoming confused in familiar places, forgetting important appointments repeatedly, having difficulty following conversations, or showing sudden personality changes is different. These symptoms are not considered a normal part of healthy aging and deserve medical attention. Memory and thinking problems have many possible causes. Some are temporary and highly treatable, including medication side effects, vitamin deficiencies, thyroid disorders, dehydration, infections, depression, or poor sleep. Others may be related to neurological conditions that benefit from early diagnosis and management. The earlier these problems are identified, the greater the opportunity to address reversible causes and provide appropriate support. Family members are often the first to notice subtle cognitive changes. They may observe repeated questions, missed bills, unusual financial decisions, getting lost while driving familiar routes, or changes in judgment that weren't present before. Having an open conversation with a healthcare provider is an important first step, rather than assuming these changes are simply part of getting older. One common theme connects all 7 warning signs. They are often easy to ignore because they develop gradually. People become accustomed to feeling a little more tired, losing a little weight, or becoming slightly more forgetful, until those small changes slowly become significant. Listening to your body does not mean assuming the worst. It means recognizing when something is unusual for you and seeking professional advice before a small problem becomes a larger one. Routine medical checkups also play an important role in staying healthy after 60. Regular blood pressure checks, diabetes screening, cholesterol monitoring, recommended cancer screenings, vision and hearing tests, vaccinations, and medication reviews help detect problems before symptoms become severe. Preventive healthcare is one of the most effective ways to maintain independence and quality of life as you age. Healthy daily habits support your body as well. Regular physical activity, a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, adequate sleep, avoiding tobacco, limiting alcohol, staying socially connected, and managing stress all contribute to better overall health. While these habits cannot prevent every illness, they strengthen the body's ability to function well and reduce the risk of many chronic diseases. Remember, these warning signs do not automatically mean you have a serious illness. Most of them have many possible causes, and some are relatively minor or easily treated. The important message is not to ignore persistent, unexplained, or worsening symptoms. Early medical evaluation often leads to earlier diagnosis, more treatment options, and better outcomes. Thank you for watching. If you found this information helpful, please like this video, subscribe to the channel, and turn on notifications for more evidence-based health information designed to help you stay active and healthy after 60. Share this video with your family and friends because recognizing a silent warning sign early could encourage someone to seek medical care when it matters most. Your body often speaks quietly before a serious illness develops. The sooner you listen, the better your chance of protecting your health for years to come.